is accredited in the United States.
And the good thing is, for example, in the United States, that we talk the same language now because of this certification.
The medical is easier here now than ever.
They do this Jason Bourne stuff, like in 30 minutes, the brother was calling us. We want that everything that happens in Punta Cana stays in Punta Cana. Okay, we're gonna service to everybody. In IMG, we like to complicate ourselves. We don't sell shoes, we give a demand service. I have the only newborn ICU unit in the area. If for any condition you cannot go to the hospital comes to you.
The Dominicans say Punta Cana is the country, and it is not the country. For the record, Punta Cana is the center of the world. Hi, welcome to the Punta Cana Podcast. My name is Cheryl Henderson, your guide to Punta Cana living, and today we have a very important topic: healthcare in Punta Cana. And our guest is Miguel Russo, the General Manager of IMG, International Medical Group, which is the only hospital in all of the Dominican Republic that is accredited in the United States. Welcome to the show, Miguel. How are you?
Very fine. Thank you, Cheryl, for having me here.
Yes, and thank you for being here. So can you tell us a little bit about your role as the General Manager of a hospital?
Yes, of course. When they ask me how is the life in a hospital, and I always try to give them the idea, look, a hospital is like a hotel with the speed of an airport. And as general manager, you have to mix and serve those two worlds in one. Because on one side, you have all the health staff, nurses, doctors, pharmaceutical, lab technicians. And on the other side, you have housekeeping, maintenance, operations, security. And to give the patient a good quality service is not just give him a recipe or prescribe him a drug, but they need to have an experience that we don't want him to come back, but that he knows that this is his house. And for anything that it needs, we're here. Because like I say, we don't sell shoes. We provide health service, and people come with a problem. We have to alleviate that burden, not complicate it more. Mm-hmm. So, as general manager, what we try is that to have the doctors comply with all the protocols. And now that we have US certification, the standard is super high, because it's not like the old model. Like everybody comes, for example, I study medicine in Cuba, but my medical director study in the United States. I have doctors that study in Argentina, others in Spain.
Wow.
And everybody has a different protocol. What we do when we do this accreditation is that we have one protocol. And it's like the United States. If you go to a doctor and you have pancreatitis diagnosis, you're going to have the same diagnosis if you go to New York, if you go to Texas, if you go to California. So in here, in the old way, is that you go to 10 medics and you have 20 different diagnoses.
Right.
And although you have the same diagnosis, you're going to have like 30 approaches. No, we have only one approach, which is certified, is protocolized. And on the other hand, to give the hospitality service to the patient, that that you feel comfortable, that your family is comfortable. And the first thing with that accommodation is information, because like I tell you, everybody goes with a problem and they want to know. Sometimes it's best to say, we're gonna address the situation, and if we cannot handle it here, we're gonna send you to a better place, or the perfect place for it.
Yes. And I know that I've had my own personal experiences with IMG. I have small kids that are always into something, 8 and 10 years old. And so we've been there a couple of times. And what I really love is the level of service that they receive us very well. They check the insurance. The ER works very well in getting appointments with doctors. So the hospitality piece, I can definitely vouch for, as well as the services that you have there. And so I imagine that you get a lot of patients who don't speak Spanish. I mean, we're in a Spanish-speaking country, but can you talk a little bit about servicing foreigners, languages, and managing that? Because that's a question. If we're talking with the doctor, are they speaking our language, even though it's medical language?
Yes, actually, the project of IMG was conceived as a medical tourism venue.
Wow.
One of the things that make easy to get this accreditation is that the board, the principal owners are engineers, so they build the structure according to the JCI, which is the Joint Commission International standards. So we have that check from the beginning. One of the things here in the area is that you have a lot of foreigners. You have Americans, Canadians, Russian, Ukrainian, Spaniards, French. Like I tell you, the first commodity that we have to provide is good information.
Yes.
So
Communication.
language cannot be a barrier in our hospital. So for that, we constitute an international department, which we provide French, English, Spanish, and Dominican, because they're not the same, incredibly. And at some point, if needed, we have Russian and German. So
Wow, so you have folks who can translate in any of the languages,
Yes.
the physicians or assistants to the physicians? Who
Yes,
can,
yes, of course. Well, actually, we had I can give you this case. This patient that he was on a cruise on the Caribbean, and they have to take him out on Martinica because he has a heart attack, and he was German. I don't know. Apparently, nobody talked, and they call us. We do the concierge service, and they were so good with what they get that they say, "Can I ask my insurance to get me there?" Yes, like 1 hour in helicopter. So like, I'm gonna talk to my insurance, and 45 minutes the insurance call us. Look, the patient wants to go to DR in Punta Cana. Can you handle the heart attack? I was like, yeah, of course, because the information it's the basic thing. Because it's not the same that, for example, when you're a tourist and you're here having a vacation, and something happens, no matter how small or how grave, you need to know the information and
Yes.
to be aware that the service that you're receiving, it's
And
good.
that is so important. And I can absolutely attest to being very, very impressed with the professionals, their level of knowledge, and being able to explain to me in my language what is going on and help me and advise me. And so you mentioned insurance, which is very interesting because I wanted to ask about insurance as well, that you dealt with a tourist and was able to work with their insurance at home. Can you talk a little about the insurance options?
Yes, of course. We have like two gammas of insurance, and in like the local ones, that is the Dominicans that reside here and have their national insurance, which we kept. Actually, we were the first hospital in the area who took Senasa, which is like Medicaid in the US. When nobody was taking it, we were the first one to take it. Like, okay, we're gonna service to everybody. Actually, if I can tell you, this is kind of fun. We changed the name from IMG. At the beginning, we were only IMG, International Medical Group, and everybody thought that we were a foreign hospital, that we don't
that's
accept Dominicans.
interesting. Yes.
So we have to put hospital in at the first. So now people is aware that because hospital in DR usually is related to public service.
Okay.
But now people say like, but they say they are in a hospital, so they attend Dominicans. It has been a super fun experience that people sometimes get in with the Senasa insurance and they say like, look, what I have is the Dominican, the government insurance. I said, that, yeah, we took it here. And
We can work with it.
it covers you fine. Don't
Nice.
worry. There's no problem.
Nice.
The other side of the spectrum is the international insurance, which is divided into travelers assistance and insurance. And we, on that gamma, we take more than 80 insurances.
80
from
insurance.
From all over, all over the world.
So pretty much most of the major ones.
Yes.
Okay.
Basically, we are our more group is United States, obviously, Canada, then Europe, and South America. And all the travel assistance is the one that when you're traveling, you have some health issue, and they give you the cover. Usually, they say, "You look, we're gonna we recommend you to go to IMG because we have an alliance with them, and we know that they're gonna go with the standard and the protocols international established. And then are the normal insurances, like, for example, Blue Cross Blue Shield, which we are the only ones who take that, because now, like, we are accredited in the United States. They say, okay, now these guys are complying with what we looking for our insuree. Sometimes this insurance, what they say is, okay, I have an expat, for example, in Panama or in Venezuela, and we have to move him, but we cannot move him to the United States yet because of the condition. Can you provide us the service? And say, like, yes, of course. And for those people who live here, that sometimes you have Medicare or Medicaid, but you're living here and you want to stabilize your situation because your package is in the States. So we do that. And the insurance send it to us, like, stabilize the patient, and then we're going to pick him up. Or if stabilizing means doing a procedure, like, I don't know, a heart catheter or a surgery. So they give us the... And the good thing is, for example, in the United States, that we talk the same language now because of this certification. Because, again, information is what they need. So when they see that we send the medical report as an American hospital, is, I don't know, these guys are doing it right.
They understand. So you receive patients who have Medicare or Medicaid, who are on vacation, something might happen to them, but what would be the scenarios, say, if they live here? Is that a possibility? How do you manage expats who are actually residing in the area?
There is like a few examples. For example, there is the veteran insurance.
Veterans insurance.
Yes, they have TRICARE, and I don't remember the other name of the insurance. Through Blue Cross Blue Shield or Humana, that they have international assistance, they do it through us.
Very interesting. So that's good to know that veterans with their insurance can also have coverage here in the Dominican Republic, working with...
Well, actually, there is a medical center. It's based here, but is U.S. run for veterans.
Yes.
And, for example, we provide...
VCCA.
Yes.
Yes.
And we provide the services, the health services that they need. We are the providers from them.
Okay.
And again, if it's something major, what we do is stabilize the patient and send him to the state. But sometimes you're going to get the same quality, maybe better, depending on the state, in here on a cheaper price.
Yes.
I'm going to give you the best example. Pacemaker. You have a heart issue with your rhythm, and you need to put a pacemaker on the patient. The same pacemaker, Medtronic, which is a brand internationally known, in the States, that device will cost you $20,000. In here costs $5,000.
Wow.
So
1/4 of the price of the actual...
The same
device here than in the States.
And you're going to be... So the total amount of everything, procedure, putting the device, everything, it's going to be around $12,000, $15,000, everything. In the States, just the device is $20,000.
Amazing. And this could be part of the reason that medical tourism is growing. International medical tourism is because you can get maybe some of the same procedures for a fraction
and faster
of the cost, and faster, because how long does it take to get an appointment for?
As soon as you request it.
Yeah.
We don't have long lists,
wait times.
because one of the thing that specialize us is that we do consultation on demand. We like to address this as a boutique service, because we don't want the patient to have a waiting list, because we want to provide a very personalized service. Again, communication.
Yes.
Good information.
So exactly how does that work? Is that online? Is it an app? Is it they make a phone call?
Right now, you can go to physically, do it online, or do it by phone or WhatsApp.
Oh, so all the options, all of the above. D.
Yeah,
all of the above.
I know that in the near future we're gonna have an app. What we want is the patient to feel at ease and comfortable. And at the same time, a foreigner comes, his doctor is in the United States, for example, and he is accustomed to that service. And when he gets here, he will receive the same service.
Yes.
And when we talk to his doctor, which it's our first recommendation, look, we need to talk to your doctor and tell him what's going on and talk about the progress or what we are recommending to do with your issue. I can tell you, for example, it happened once. It was this woman. He was a tourist, and on her bucket list was to come to Punta Cana. She was a cancer patient, and in here she got a complication. And what we do was talk to the insurance and tell, look, what she has is a very complicated complication, which she's alone. We don't recommend to address it here. We're going to keep her stabilized till you can send an ambulance and expatriate her. We need to talk to the family. They start doing the process, but it was taking long. So again, because of the certification and all this process that we have carried out, we have a very good communication with the U.S. Embassy. So what we do was call them and say, look, we have this situation. We have a U.S. citizen here. She's in critical care, and we need to reach out to his family as soon as possible. So we discussed all the possibilities. And what can I tell you? I don't know. It's like they do this Jason Bourne stuff. Like in 30 minutes, the brother was calling us.
Wow.
So we explained what was going on. He was aware because it was her last wishes to come to Punta Cana.
Wow.
And we help him through the process. And the process, what I want to result here is that, or highlight, is that it wasn't the medical stuff that they like. It was the personal situation, because you have your family abroad, away, in what you think it is a third world country, an Iceland. No, you're receiving the same quality in healthcare that you're going to have in the United States. And in your language, right away, the doctors, we are communicating with them because, I have listened, I have been around in all Central America and South America. And one of the problem is that Latino doctors don't want to talk to U.S. doctors, or because, complex. When they're talking to us, I say, no, wait, we're talking with people who know what they're doing. And it's like a very like a handshake that they say to the family, look, where you are, stay there till it's stabilized. They know what you're doing. Yes. So it's fill us with joy that and the patient comes at ease.
Yes. And I really love hearing about the services, the various services, and how you're handling different situations, because we get a lot of questions as, let's say, real estate professionals, with people who are thinking about living here, thinking about moving here, thinking about buying property here, thinking about making Punta Cana their home. And one of the major questions we get is medical care, medical services. So I think this is really nice to be able to talk about the level of service, not only medical, but personal, and being able to work with the medical insurances and the embassies and those institutions to assist patients. I think that is really, really, really wonderful. You have dreamed of the perfect Caribbean beach lifestyle. With Boardwalk Developments, we have the blueprint for you in this tropical paradise. Celebrate incredible returns when you elevate your investment portfolio with the hottest real estate in Punta Cana. Invest wisely, live lavishly. We'll show you how. Contact Boardwalk Developments, Punta Cana. I want to ask about the different type of services that you provide. Are there certain services that you do and don't? Do you cover, just talk to me a little bit about the various types of services that you provide.
Well, in IMG, we like to complicate ourselves.
Oh, really?
It's really a fun thing. When our chairman would start building the hospital, he talked to other owners of hospitals in the area, and they say, look, don't complain, don't complicate your life. Do the most general thing, and everything that gets complicated, send it to Santo Domingo, which is the capital of Dominican Republic. But no, we want that everything that happens in Punta Cana stays in Punta Cana.
Nice.
Actually, I have this conversation with other people. So like, look, my competition is nobody here in La Altagracia or in Punta Cana. It's not to brag off. It's Santo Domingo. Everybody wants to have a medical issue 8 years ago, and the first thing they do was
go to Santo
Domingo. And now what we're doing is to establish this network, which we have done it very thoroughly. The standard of living in Punta Cana are very different than Santo Domingo. Dominicans are very capital, like the center of the world is Santo Domingo or Santiago, which are the main cities, and everything else is, like they say, is
Campo.
Snakes and Monte Culebra. It's snakes and
yes.
and mountains.
The Dominicans say Punta Cana is the country, and it is not the country.
Yes.
It is a very nice place to live. For me, being a foreigner, I have to say, when I go to this is a sidebar. When I go to Santo Domingo, I'm like, oh my gosh, these tall buildings, traffic and all the highways and everything. And I come back to Punta Cana, I'm like, So for me, Punta Cana is the center. So let's just, for the record, Punta Cana is the center of the world.
And, we have some obstacle about, for example, the population.
Yes.
So that you be aware, for example, of how you measure to put a service in a hospital or a clinic.
Yes.
We are the only hospital to have an MRI machine.
Wow.
And when we put it there, it was like going against the wave, because for that you need to have at least a population of 1,000 people in the area. At that moment we were like 60, 100, and that was before COVID, of course. Or you need 10 to 12 specialists who send that study. But we say, look, it's not there, it's not available, it's very hard to go to Santo Domingo, let's do it. And it has been very, very fine, and because now Dominicans and foreigners are receiving that service, which that 7 years ago you have to go to Santo Domingo to do an MRI.
Yeah, I remember that. I remember even having to go to La Romana and always having to travel to get certain things done, even to get certain studies or to give certain samples. I would have to go far to get those done. And it is very refreshing to know that really everything that I need nowadays, I can get right in Punta Cana.
And
amazing.
To get you back at it, we like to complicate ourselves. And now the population is growing.
Yes. For that reason.
It's
around
kind of now 300, badly count, but it's getting bigger. And now we are trying to bring more specialists. For example, in the area, there wasn't a neurologist. Now we have a neurologist, which she comes every Wednesday, and she addresses all those aspects of neurology. And for, those very, very specialized services, what we have done is built a network around the entire country, which we work with hospitals in Santo Domingo and hospitals in Santiago, because part of our network is provide service to the Dominicans. But for example, if a patient is in Puerto Plata, a foreigner having in a vacation and something happens, so they call us to concierge the medical services and say, look, we can do that in Santiago, or no, we can do that in Santo Domingo, or look, we recommend it, bring it here because the airport is closer, the air ambulance can land, and it's going to be more easy for the patient. For example, there is this procedure that is a special endoscopy that there are only 3 persons who do it in the entire country. We have an alliance with those 3 doctors in those 3 centers. Right. And the difference in where we send it, in the case of Dominican, is where his insurance cover it. We give them 3 options. Or, for example, in international insurance, the first that answer us.
Yes.
So
Wow.
You know,
So we're covered.
Trying, we're
covered.
trying, and what we don't have here, we know where to send it.
Beautiful.
And it's like, and for example, I'm sending you to Santo Domingo, but we have part of the alliance is that our patient comes first. So the patient don't have to go like, you don't know, like I'm sending you to, I don't know, whatever place in Santo Domingo, and you have to go at 6 a.m, do a line. No, they're going to be waiting for you. Miss Cheryl, you're from IMG. Yeah, we're expecting you. Here's that. Sign here, sign there. If you have to pay any difference, you do it. And when everything's finished, the doctor calls us. Okay, everything's done. So, you know, we're elevating that standard. People feel super comfortable because now they don't lose that time. Santo Domingo is crazy. And that is what I tell you, that we want to do a more boutique service. We don't want that you go and you have an appointment at 10 o'clock in the morning and it's still 5 in the evening and you still haven't seen the doctor. We don't believe in that.
And that happens everywhere. I mean, if you got that figured out,
it happens to me.
Yes.
With my wife, her doctor, her endocrinologist, which is something that we introduced now in the hospital. He said, look, I want to do a special sonography of the thyroid, and the only person who knows how to do it is in Santo Domingo. Okay, there's no problem. I know the doctor. He's a colleague of mine. He's like, look, I'm going to go with my wife. How you can accommodate? We're in Punta Cana. Okay, can you come at 2 o'clock? I'm going to be waiting you. Oh, yeah, perfect. That's fine. We arrived incredibly. Punta Cana people are always first that the people in Santo Domingo. And we're there. And he get like in his consultation at 6 o'clock. It's like, really, dude? Like, we're colleagues. We're supposed to do, imagine a John Doe. What you going to do? So that is something that we don't want to do here. And actually, what we're building here is not a simple hospital. We're building a brand, which we want to, in a near future, extend. Why not Santo Domingo? Why not out of the country? Because what we want to support our healthcare in a very good service.
Amazing. So do you offer also, in addition to everything else, mental health and well-being?
Yes.
Tell me about those programs.
We have in-house psychiatrists and a psychologist team, which work 24/7. I can relate a situation that happens. Sometimes people get these accidents and they need this support, especially when they are on vacation. Our psychologists are top of the notch. People go super fine. And sometimes, after COVID, we do a survey in the hospital to see how our collaborators were. We discovered that it was the level of anxiety in our hospital staff was super high.
Yeah, that was
for
universal.
For our amaze, it wasn't the health staff. It was the administrative staff.
Oh.
So we start a campaign to lower those levels of anxiety. In one of the staff meetings, we say, like, if this is happening here in the hospital, what's going on everywhere? And we start a program which we are providing to hotels especially, that we go, every staff member or manager has to go and address one issue. For example, anxiety, I am the one in charge of going and doing the anxiety speech. The medical director, which he's a gynecologist, he do nutrition and beauty of the spirit. And we have doing this program, and the commercial manager do nutrition, health and nutrition and fitness. And we have feel that rapport with the people. When we are walking, hey, you are the guy who talk about the issues and everything.
Nice.
And it's
nice.
like, yeah, that's me. And part of our objective, besides giving a good healthcare, it's giving back to the community, which we do it through our foundation. Mostly, it's more targeted to children and girls. And the other pillar is academic. for example, we want to elevate the standard with our nurse practitioners. So we did an alliance with the Jackson Memorial in Miami, and well, actually it was like the beginning of December. They came and they do all this education program on how to deal with pregnancy, newborns, that, you know, in the States, they have another standard for it. It was amazing. And now, at the end of this month, we're going to send 10 Dominican nurses to Jackson so they see how things work there. And they say, no, because right now that they say is, yeah, you're telling me that we're accreditation, that we have to do it like this because you're telling us. No, now they're going to see that it's
exactly
not us.
why.
It's why.
Yeah.
And, you know, we want to elevate that. We want that our nurses speak English.
Yes.
Why not French? At the same time, pharmaceutical staff, image technician, lab technicians, because it's all part of the equation.
I think that is really wonderful.
Imagine waking up in paradise. Forget about those ordinary all-inclusive resorts. Welcome to Boutique Hotel Las Flores, a secluded oasis in the heart of Punta Cana. Come, let's take a look.
I just so appreciate hearing all of the services that you offer and that you provide, and just listening to you mention anxiety and prenatal and babies makes me really want to shift a little bit and get to know more about you personally. So I understand that you are a new father for the first time.
Yes, I have 7 days now.
7 days! Woo!
Father, I have survived so far.
Congratulations.
And my wife and the little one have survived us. I don't know. It's been like a roller coaster. It's been super fun. He was born in IMG, of course.
Okay.
Because we have a wonderful pediatrician staff there, and it's awkward because my brother fathered his daughter a month ago in the Baptist in Miami. So, you know, he's telling me, "You're crazy. You are in the countryside, Punta Cana. What you're doing?" So, look, my son is gonna birth in under the same standard that your daughter. No. We are in the state, and you know, it's not, everything is different. It's like, no, it's the same thing.
Did you tell him IMG is accredited in the United States? We could operate in any city in the United States with the same standards.
And the good thing is, right, look, they do here, they put him the Hep vaccine, check.
Yes.
They do the audiometry check. The eyes, check. The vitamin K, check. So why I came here? Because you want to have a U.S. citizen daughter.
Yeah.
Mine's gonna be from Verón, Punta Cana.
Perfect.
Which, you know, it's super sometimes awkward because everybody asks me, like, where are you gonna have the kids? Like, here? Why I have to go other
Somewhere
place?
else.
And like, imagine the general manager. I tell my board, like, they ask me, like, it's gonna be here. Like, of course.
Yes.
And for example,
And that's because it's just Punta Cana is really growing up. You know, 15 years ago, maybe nobody was thinking about having babies because everything was very different. But Punta Cana has really evolved as a town, evolved as a city,
Yes.
actually, with medical services and all of the services that are required to be very comfortable living here every day. When I first moved here, there weren't even roads. Like you said, Monte
Culebra, yeah.
Culebra, like mountains and snakes. But nowadays we need, and I'm so happy that you're here to let people know that we operate at a very high standard. This is not a third world city. We're capable of providing all of the services that are necessary for medical services, in particular in this case. So I think that is super.
I can tell you the most important aspect or thing that I can tell you about my newborn is that you can see in his face that there is no anxiety. because there's no noise. Everything here is so super relaxed.
He's an island baby, right?
Yes.
Literally.
And a beach baby here with the
Yes.
sun and like
Yes.
everybody say like you have to put him on the sun. Don't worry, there's no problem here. with
Yeah,
that.
of course not.
And my brother's wife, when she came with my niece a couple of days ago, she was amazed of like the tranquility where we live in. Like you say, like they live in a 4x4 apartment in the center of Santo Domingo, which at 6 in the morning is tang tang tang, and honk 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 honk, and everybody is
The city.
so people are aware of that. Santo Domingo is like a Frankenstein gone very wrong of New York. It's a very
I've never heard that before.
mutant version of New York. It's super loud, it's super disorganized. And when they come here, now they're thinking in moving in here. So they say, wait, this is like the
They will
tranquility.
not be the first. A
I
lot of
can-
people are moving.
I can go in the afternoon to my house, have eat with my family, take a nap, and come back to the hospital. You cannot do that in Santo Domingo. That is in any city right now. You cannot do it. So it's like I say, yeah, we're in an island in a third world country, but with first world standards.
Yes.
And
Love that.
One of the things is, for example, everybody, well, is what happens if the birth gets complicated? I have the only newborn ICU unit in the area
There you
with
go.
a specialist there. So
There you go.
check.
Check.
The OBG doctors, top of the notch. My wife, super comfortable. She comes from the hotel business, which hoteliers are ultra picky. They're always finding something. Actually, when my wife visits the hospital, she goes like on the bars, going like, okay, they cleaning, everything is good, everything is good. Like,
Yes.
so they're aware of demand and what they expect. It's super high.
And the feedback is universal. I have, especially our Canadian clients, especially come to the hospitals here and they're amazed at the service, at the cleanliness, at the organization, at the speed, everything, especially Canadians. So,
Yes.
that has been surprising to me that they come and if they have an experience with the hospital, they're instantly impressed.
No, and when they are French speaking, when they receive that information in French, they say like,
Wow.
"Wait a minute, you're speaking in French?" He said,
Yes.
Oui.
Oui.
And you see in the patient right away, like the level of anxiety, like go down, like, okay, like I'm in a place where I'm gonna talk to somebody. There has been other idioms that we have to try, or we have done it through a Google Translate, which is frustrating. And I understand the person who have an issue trying to speak through a device, but when you speak face to face and I can see you eye to eye, man, he's speaking my language.
So do you speak French?
Oui.
Okay, so what languages do you speak while we're
I speak Spanish, Dominican.
obviously?
No,
Because
Spanish
you're
and Dominican.
Dominican.
No, Spanish
Okay,
and
wait.
Dominican is not the same.
That's true. Spanish and Dominican are two
No,
different
these
languages.
are two different
Yes.
languages.
Okay.
I speak English.
I speak Dominican, by the way. I don't know about Spanish.
I speak and understand French. And Portuguese, because I used to live with Brazilian when I studied medicine. I understand Italian. I was a disgrace, my grandfather's standard, because my family from my dad's side are Italian, and from my mother's side are Lebanese. So I am not loud because I'm Dominican. I am loud because of the three, because
Yes.
Italians are loud, Lebanese are loud, and Dominicans are loud. And I remember my grandfather say like, why don't you speak Italian? It's like, and I said like, what for? You don't need that. Like, I'm gonna kill you. This adventure has been, everybody was concerned. Like, look, you're 40. You're gonna know what is not sleeping. I was like, I'm a doctor. I know I don't sleep
Yes.
like I'm 22. I don't
Yes.
know what it is. And before that, I used to party hard. So
It's par for the course.
the
right?
only
It's the
thing that
next
shifted is
stage.
that now I'm like, I'm reading a book while the little kid, it's like,
Changing diapers.
yeah, no, and especially when we were talking a little bit later before, they love to do the disaster once they're clean. I was like, and like he sees just like,
Welcome
did it.
to parenthood. Welcome to parenthood.
And-
they wait for that. They like a clean
Yeah.
surface to come in for that landing.
And I can tell you that, and I know that it's not because one of the things that has helped us, because my wife is an expat and her family lives in Texas. My family doesn't live in Punta Cana. They live in Santo Domingo. So the familiarity and the emotion closeness that the staff in the hospital have deal with my wife, we didn't feel that we lacked the family touch.
Nice.
That thing is not because I am the general manager of the hospital. That is something that everybody receives. And I can attest firsthand that I'm very proud of,
Yes.
of my staff, because my wife...
And I can tell you, I'm very proud too, just being from Punta Cana, having lived here for the last 18 years, to know what it was like before and what it is like now, and that
Yeah.
we're continuing to improve is just amazing. So
One of the things, for example, that I love when people comply, like, look, I have 20 minutes here waiting in the emergency and nobody has attended me. Yeah, hey, sorry, we're handling an emergency right now, but don't worry, it's going to be like 10 minutes, 10 more minutes. It's 20 minutes. And it's a complaint that
That
I
is
will take it
nothing.
any day.
you can spend all day and all night in the ER.
And
I mean,
I don't know that I don't like, the staff come too much to the room. They ask too much question. Those are complaints that I will take anyway, because
Yes.
it's what making me sure that the patient is receiving that attention. We are a day in the hospital is 6 a.m. comes the people with the lab to take you blood. 6:30 the nurse. At 7 the doctors. At 7:30, at 8:30 the people from the concierge department to see how is everything. So people is like, it's enough. We're fine.
yeah, but that
We want to
is
sleep,
good.
and
What
that's
you don't
good.
want is to be sitting there with no attention at all.
Yes.
You want the attention.
And one of the things that, for example, that in this process with my child's birth, my wife asked me, or people, so what you gonna do? I'm the father here. I'm not. I'm not her.
not
I'm not the
working today.
doctor. I'm not your doctor. I'm not his pediatrician. Ask her. And when they came, I know that it's like staff boss relations. They're like,
yes.
hey, I'm not your boss. I'm not a doctor. I'm the father.
Yes.
Do your work and
Yes.
talk to the mother.
If you want to get rich in real estate, download my PDF.
We have a tradition on the show where we take some questions from our community. So let's see what we have here for you. Go ahead and pick one.
Okay.
I can read it, or you read it.
I'm thinking of moving to Punta Cana, but I have a heart condition. How quick can I have help if needed? One of the things that I can tell you that you're gonna receive the attention in less than 20 minutes, depending on in which location you are in Punta Cana. And on the hospital, they're gonna address your health situation right away, because when the medical issue is the patient comes first, and then we ask questions later. So if you need a catheterism or a pacemaker replacement, we're gonna comply with the American standard, and probably less than 20 minutes.
Great. I have another question that actually is a question that we do get from people sometimes. So I want to add a second question here. And that question is, how easy for an expat is it to get prescription medicine, prescriptions that they have from the U.S.? Can you answer that?
Yeah, of course. It's super easy. And I'm going to relate to when I tell you that we give a demand service.
Oh,
The only thing that patient needs is to go see one of our doctors, depending on which of the specialty he needs, gastroenterologist, internist, cardiologists, neurologists. It's one consultation away to confirm the medication, and that's it. They give you your prescription, and then you go to the drugstores and have it.
That's so easy.
Yes.
So
It's more faster than in the United States.
I know it's incredible that it just seems like the medical is easier here now than ever. Just in closing, are there any additional points that you would like to make on behalf of IMG or your services?
Well, yes, just to highlight that we are concerned about the quality of the health, and we always improve in the technology, and that's why we are improving our telemedicine network.
Telemedicine?
Which is if for any condition you cannot go to the hospital comes to you via a special application, especially for for mental health. The other thing is that we just start last week is our dialysis center, which there is a lot of people who want to come to live or vacation in Punta Cana, and because of their kidney condition, which they need dialysis, they cannot do it. Now they can do it on an affordable price or covered by his insurance probably.
Dialysis. Wow, that is something new. Always something new. And
Yes.
I'm so excited about what else you might have to come. What I really love about living in Punta Cana is that it's just always improving, always something new, always something better. So I thank you, doctor, for being a part of the show. And could you tell everyone how to find you or the hospital?
Oh, they can reach us through our homepage via mail or on the internet online. We have Facebook. I look young, but I'm old. Instagram, TikTok. We are on all the social media, and we are one click away.
Beautiful.
And I'm very pleased that you honor me with this opportunity to talk about the hospital.
Likewise. Thank you for being a part of the show, the
My
Punta
pleasure.
Cana Podcast. Thank you so much. And we'll see you on the next episode of the Punta Cana Podcast here from my penthouse. I'm Cheryl Henderson, your guide to Punta Cana living, and we'll see you on a future episode.